And so once they hear that they have the diagnosis of breast cancer, there are a few things that we need to do in order to get them to recovery. The first thing we do is we schedule them for a breast MRI. And a breast MRI is very sensitive, and we do that not only to look at the affected breast, but the contralateral breast. MRI can find lesions as small as 3 millimeters. And unlike mammography and ultrasound, MRI gives us physiological details. So we can see blood flow in, blood flow out, how fast that's occurring. And so we can often find other cancers that are occurring in the same breast, the other breast, or it also gives us a more accurate size of the actual cancer that we've also diagnosed, which is important when that patient ends up going to surgery and becomes staged and deciding on the type of surgery that they're going to have. So we always get an MRI, and then the next step, we get them in touch with a surgeon. There are several surgeons that do breast surgery, but there are a handful that do only breast surgery. And so we try to get our patients in with those physicians. And then I've had the unfortunate task of the last few weeks of diagnosing my closest friend here in the city with breast cancer. And so I went with her to her surgical consultation. And that was an hour-long process, and they gave her diagrams and details of all the possible options and outcomes and what can happen. And so it's a real thorough evaluation with the breast surgeon. And also that surgeon then will get them in touch with an oncologist if they need additional or adjuvant treatment of chemotherapy or radiation therapy.